You know, long before I came back into to healthcare, these were my own personal observations of the challenges that the healthcare industry faces, which is interesting because they're almost identical to a lot of the challenges that we face in the mortgage industry, in the gaming industry, and technology. I spent about 8 years working in and out of Silicon Valley. And what the interesting theme here is that quality, service, and cost of delivery can all be addressed by attacking innovation, by attacking the manual processes, by attacking the number of administrative personnel in particular. And I'm not trying here to put people out of work or what have you, but in the healthcare system, there was a gentleman from Harvard University that came to speak to our physicians. I can't remember the statistic he had, but it was like we had about 1.5 or 2 administrative people in our healthcare system for every clinical person. It was an incredible ratio. I mean, if you ran your law firm that way, if you ran your own business, you had more administrative people than you had touching your customers. That business model is not going to survive for very long. At the end of the day, what I've personally seen in US Oncology, we're focused on virtually every one of these and a whole lot more to try and help improve the quality, improve the service, and improve the cost of delivery. I've actually seen it in some of the other health organizations, even here in Houston. My wife was actually in the hospital at Memorial Hermann about 6 months ago, and we were new to Houston. I didn't know what was going on. I was a little freaked out, and I walked in and I thought, oh my gosh, you know, what's going to happen with this particular process? And it was a remarkable experience. I think Memorial Hermann, it really understands from the patient's perspective how to really handle a patient going through their system. One of the family members, we never touched one single piece of paper, okay? I walked around, and, you know, I'm new to the industry, I'm trying to research and understand and learn as much as I can. I walked around, didn't see any paper on the nurses' stations. I thought, interesting, a lot of technology, a lot of very, very positive things there. So there are organizations in healthcare that understand these challenges and are trying to work hard to make the changes. And again, this is a real opportunity. Now, my next comment is going to probably be somewhat controversial, but that's hopefully okay. I'm learning that, you know, now being in Texas, I can be a little controversial. Or in California, they might throw me over the Coronado Bridge. But I believe that if the entire system could address these issues and a few more, that we could pay for almost 1/3 of the new healthcare bill. And that's a staggering number, but if you look at any business, and these other businesses that I've had the pleasure of working in, that have taken costs out, have improved the quality and improved the service, they've improved their bottom line, and they've taken those dollars, not necessarily to save money, but also to reinvest back into the system. So what should we do? Well, there's an old saying, pioneers get shot and settlers get rich. And I humbly believe that we should follow the leaders, and we should take a chapter, maybe 2 or 3, or the entire book out of some of these other industries and apply them as much as we can across the board into the healthcare system. Walmart's a great example. Walmart has more than perfected the supply chain process. US Oncology, we just hired 2 weeks ago a supply chain expert. We spend tens of millions, if not several hundred millions of dollars on just basic supply chain things. And to use that same methodology to take those costs out so we can take those dollars and reinvest them back into things such as technology and process improvement. At US Oncology, for example, we have over 80 Lean Six Sigma, blue, black, and green belts working on processes in our practices every day, working with them right now, today, to help them understand how to improve the intake process, how to improve the scheduling process, how to help the pharmacists mix the drugs better, and how to avoid waste. These things are very, very important, and we try to look at it from our perspective, and I can, again, see other companies in the industry looking at it that way to try and improve the system and looking at it from a business standpoint. Healthcare is a complicated industry. It's a lot more complicated than technology, I'll tell you. But it's also, banking is complicated. It's your money. Healthcare is your health, okay? And we know we can't live without money, you can't live without good health. So I think there's a lot of synergies and a lot of themes that are common here. I get asked the question a lot about consolidation. And will there be consolidation in healthcare? Mike, you saw that and you lived it through the banking system and through the gaming industry. The answer is yes. I think there will be consolidation. Will it be as pronounced as banking? I'm not smart enough to know, but I don't think so. Will it be like the gaming or the technology business? I don't know. Again, I'm not smart enough to know. But I think there will be, and I think there needs to be in certain parts of, in certain sectors. The last point I wanted to make here was the recent legislation that John and Jim were speaking to carried a really exciting element, and that is the Accountable Care Organization part of the legislation, which is about focusing on the quality of the care that's delivered to the patient, not just in the units of care. And I think that's really a critical part of how our healthcare system has to change overall long term, back to the three things that I think overall need to really be focused on: quality, service, and cost of delivery. It's my last slide, and I'm a big Roadrunner Coyote fan, and those of you that are, thank you. Those of you that aren't, I apologize. But I show this slide to our physicians, our 1,300 physicians, when I'm out on the road with them, to try and help drive home a point, and that is, we have to continue to stay ahead of the economic environment that is ever changing, the healthcare environment that is ever changing, and the demographic change. And the best way to do that is to focus on innovation, service, and quality, and again, cost of delivery. I'm very, very happy and very proud to be part of the healthcare system again. I'm even more proud to be part of US Oncology as a part of that part of that system. And I'm very bullish, frankly, even after only being here for 18 months, that the opportunities that we can achieve and the money that we can save and the improvements we can make in our system and our process are really at our fingertips if we can just follow the leaders and really make those changes happen as hard and as fast as we can.